gentlemen, welcome to yet another episode of the Dental Talk. I'm your host, Dr. Ghulam Mohammed, and today we have a senior guest, a senior of mine who's a guest here at episode 4. We have Dr. Sara Zubair. So, for those of you who do not know Dr. Sara Zubair, I'll read out her bio to you. Dr. Sara graduated from the CMH Lahore Medical and Dental College in 2015. After completing her house job at CMH in 2016, she worked at Shalimar Medical and Dental College while studying for the ORE Part 1 and the MJDF Part 1. In 2017, she moved to the UK and cleared both parts of her ORE exam in the first attempt in a period of just 1 year. So that's for those of you who don't follow ORE or haven't read up about ORE, that's a huge thing. She is now a GDC registered dentist working in two mixed NHS and private practices in Southwest region of England and currently pursuing postgraduate diploma in aesthetic and restorative dentistry from the Royal College of Surgeons of England. During her vocational training, she completed the MJDF exam from the Royal College of Surgeons of England and is member of the Joint Dental Faculties FGDP and FDS at the Royal College of Surgeons in England. She aspires to pursue her master's in aesthetic dentistry in the future for postgraduate training, and she also offers support to young overseas dentists regarding ORE, MJDF exams, and vocational training opportunities. She runs this huge Facebook group where she posts amazing stuff which can really help people who are wanting to move to the UK after doing their BDS. Any international dentist who has done their BDS and wants to move to the UK. So without further ado, ladies and gentlemen, Dr. Sara Zubair. Okay. Hello and assalamu alaikum, Dr. Sara. How are you?
I'm good. How about yourself?
I'm good. I'm perfect. Thank you so much for taking time out for us from your busy schedule. Finally, we got some time to talk about you and your journey through dentistry. You're a senior of mine, so all respect for you. And so,
Uh,
with your permission, should we start the interview?
yeah, of course. Yeah.
Okay, perfect. Okay, so let's start a bit back in time when you started dentistry. Tell us briefly about yourself. What made you choose dentistry, and your journey through dental school at CMH, those 5 years that you spent, and who were the teachers that you looked up to during those five years in undergrad?
Well, to be very honest with you,
Yeah.
before dental school, I was doing business in NUS Business School.
Okay.
I was there for because dentistry was in Plan B, and
Mm-hmm.
I was in even during dental school.
Mm-hmm.
It was after graduation that I really became interested in dentistry, which is quite ironic. Because like as a fresh graduate, you really don't know what,
Mm-hmm.
uh, how vast dentistry is and what how amazing our field is. Um,
Absolutely.
yeah, I mean, some of the teachers to mention in our school, I think I'm an absolute fan, and most people are, of Dr. Samir Kazi.
Okay.
So he was like an amazing mentor of oral surgery, and I think when the way he just treated patients and the way his
Yeah.
patient communication manner and the way he taught us really was really nice. I mean, I think he was the only mentor who really held our hands and
Yeah.
taught us how to extract teeth. So I initially, because of him, I really became interested in oral surgery
Yeah.
initially, and that was the only thing I was interested in when I was in dental school. But gradually and slowly, after graduating, I explored other fields as well, and I became interested in other fields like aesthetic and restorative, which I'm doing
Yeah.
at the moment.
Yeah, we talked about that. We will talk about that in the upcoming questions as well. But that's perfect because so many people that I've interviewed from Lahore, all of them name Dr. Samir Kazi as their mentor, as people who they've looked up to. So kudos to Dr. Samir, and I'm interviewing him as well next week. So I'm really excited
Are
for
you?
that interview.
That's
Yeah, I
amazing.
am. Yeah, I didn't get the chance to study from him because he left college
Yeah,
when I came into final year. But yeah, I'm looking forward to talking to him. All right.
yeah.
So moving on, let's talk about your journey to becoming a GDC registered dentist. So take us through it. When did you know that you wanted to move to the UK, firstly? And second, when did you start preparing for your ORE Part 1? And what was your method of approach to these exams?
Yeah, well, initially, UK was not in the picture.
Hmm.
US was.
Okay.
I 4 to 5 months in house job. I actually went to the US, did my NBDEs. I was doing
Hmm.
also an internship in oral and maxillofacial surgery in the University of North Carolina.
Okay.
Um,
Wow.
so I was interested in oral surgery because, as I mentioned before.
Yeah.
But then back, my circumstances changed, and I got engaged basically. So I
Okay.
knew that I had to go to the UK.
Hmm.
So it was, this is how I did it. Before ORE, I
Hmm.
decided on MJDF first,
Okay.
because clinical part of MJDF helps you in the clinical part of ORE.
Hmm.
So, I was like, I had a little bit of time after house job, like a month after, when you're searching for jobs and you don't
Yeah.
really know what you. So I was like, why not just do MJDF? So started preparing for it, and it's just, I don't know, it's just how my life is.
Yeah.
I literally had 1 to 2 months to prepare for that exam,
Yeah.
because I was at the same time as working in Shalimar Hospital as well.
Yeah.
Yeah, I mean, 1 to 2 months for MJDF, passed that one, and after that, I moved to the UK, got married in the same time. Again, for ORE Part 1, I just had about 2 to 3 months to prepare for the exam. But considering
Really?
that
Okay.
I had I had covered the basic sciences from
Yeah.
NBDEs, and
Yeah.
I had covered clinical part, little bit of clinical part of ORE in MGDA Part 1. So that helped me. And
Absolutely.
my approach to the exams, I think, is pretty much, and I would advise this to other people who are approaching these exams as well, that I don't been cramming 10, 12 books to prepare for an exam.
Yeah.
You don't have to do that. People who are telling you that you really need to cram about 10, 12 books to prepare for an exam, they haven't done it themselves, to be honest, because
Yeah.
it's not for a human mind to retain that much of information.
Absolutely. Absolutely.
So,
Absolutely.
like, my method is always, nobody after graduation, when you enter the practical life, nobody has
Yeah.
got so much time to prepare, specifically like we used to do when we were when we hadn't graduated, when we were in homes and we had all the time just to study.
Absolutely. Yeah. You're
Practical life
right.
is different. So, just focus on the clinically relevant information, concise, short, clinically relevant information, because that's all what they're going to ask you in the exams. No one is going to ask you, something really stupid and out of context, and something that you're
Yeah.
not clinically on the patient. So, invest your energy in for trying to find something which is like a short, concise notes,
Yeah.
study material that concise and clinically relevant, and that will help you sail through these exams really.
Study smart. So basically study smart. Don't study books on books and books. Yeah. So that makes sense. Okay. Perfect. Moving on to the next question. There's always this aura around ORE that it's difficult to even get a seat to sit for the exam, because unlike NBD, which takes place once or twice or even sometimes thrice a month, ORE takes place only, I think, twice or thrice a year. So
Yeah.
yeah, it's pretty hard to get a seat for ORE. So what are your thoughts and experience in regards to this, and how can a dentist tackle this who wants to take the OREs?
Yeah. So basically, like, when I started, I was given the same kind of information that, it's booked for 2 to 3 years. You can never get a seat,
Yeah.
so you should just quit trying,
Yeah.
is, which I don't believe it, in my opinion, is correct. Because yes, I've been lucky both times. For
Yeah.
ORE Part 1 and 2, I got a seat on the first click,
Wow.
both times. But I do know people who've tried to book twice or thrice and they couldn't get through.
Yeah.
So I'll tell you what the trick is. just get in the booking starts. They give you a link 3 to 6 weeks before the booking starts. They send you like an email that this is the specific time in which the booking is going to start. So just, I think 3 to 4 minutes before the booking starts, just go on the site and just make sure that you've got the password and you've got your username correct, right? So you're not doing it at the last minute. So just 3 to 4 minutes, because it times you out after 15 minutes as well. So, and after that, some people make the mistake of, not paying them right away. So I think just pay them right away. Don't wait to make the payment. If you get the booking, pay them right on the spot, and have a really good internet connection ready. But don't be put down by the fact that you're never going to get through, because you're eventually going to get it on the second or third attempt.
Okay, perfect. So, okay, moving on from ORE part 1. ORE part 1 is the theoretical part of ORE. It's more of the basic sciences. Then comes the more difficult part, that is ORE part 2. Now, first of all, guide the dentist how you went on about it. There's a theory part in ORE part 2 as well, the patient handling part and a clinical part, which is obviously and always the more difficult part. How did you prepare for it, and how much time did it take? We know you did it in 1 year, both the parts. That's amazing. So
less than a year, basically.
So that's amazing. So how much time did it take you to prepare for ORE part 2, firstly? And secondly, what courses, or because you always have to take courses, right? What courses did you take, and what was your mental thinking going into studying for the ORE part 2?
So I was absolutely in shambles. I was scared to death to go to ORE part 2, because I had listened to the same things, like, you can do part 1, but ORE part 2 is impossible. That's what they always
impossible.
say.
That's the word.
To be honest, I like ORE part 2 better than part 1, because I'll tell you why. Because there are no big books that you need to read. You should you're just supposed to read the very concise study notes that have been provided to you by your course providers. So that just literally reduces the theoretical part to about this small, honestly. And ORE part 2 is basically more about reflexes. You practice patient communication, medical emergencies, treatment planning. You say those things so many times, you practice them so many times to yourself that they become a reflex.
Absolutely.
So the next time when you are, talking to a patient about pericoronitis, you're trying to explain a disease, it's just, if somebody can wake you up and you still remember that script. So you have to practice it that many times. And like, this is where we struggle, I think, because as fresh graduates, I didn't know how to do a crown prep. I didn't know how to do a veneer prep. I didn't know how to do a bridge prep. So, I was completely intimidated, but practice is the key. I think they've got 18 exercises in an exam, in the ORE exam. So 18 about clinical exercises, which are class 1 to 6, crown prep, veneer prep, things like that. I must have practiced each one of those exercises more than 200 times.
Wow.
So, practice every single thing every day. Do your BLS, do your patient communication, do your mannequin every single day. And another thing is going to the correct courses really helps you. So I owe my success to Matin, who taught me like the whole of dentistry in about 6 days. To be honest, he's absolutely amazing.
Wow.
So I went to Matin's course for mannequin, and I went to MR Dental for the rest of the components. And they're quite good courses, to be honest. And you, choose the correct courses, and you'll get through the exam.
So that's what I've heard about these courses, that although they're just 6 days long or a week long, but they can teach you everything within these 6 days, and they teach you really well.
It's true. They teach you really, really well.
Even for NBD part 2, that's what they say. So that's amazing. That's actually I've always wondered how is that possible, but apparently it is. So
It
okay,
is.
yeah.
Yeah.
So
Yeah.
okay, you did the ORE part two, but before we move on, I also have to ask you, when you graduated from your undergrad, did you know how to
Yeah.
do a crown preparation? Did you know how to do a bridge preparation or a veneer preparation, or how to,
No.
or clinically? No. Okay, so
Yeah.
you learned all of this when you went in for your ORE part two. That's when you started doing it.
That
Okay.
is true. That is true. And that is something that we really need to change in our dental schools, I think.
Yep.
I mean, it's, like the graduates from all of the countries, India, Egypt, everyone who's taken the exam with me,
Yeah.
they've done it before. And
Yeah.
I'm like, why are we wasting our time, doing general medicine pros, which ask us about to diagnose acute renal failure or Wilson's disease,
Yeah.
when it's not. I swear, we had Wilson's disease in our
Yeah.
prof,
Yeah.
which is absolutely, I mean, so it doesn't make sense. And we
Yeah.
don't know the
Absolutely.
basics of dentistry, which is, crown preps, veneer preps, which we should absolutely know.
Absolutely.
Yeah.
That's
Yeah.
amazing. Okay.
Yeah.
So moving on. So now you've passed both the parts, and then this long process, agonizing process of getting registered with the GDC starts. And
Yeah.
along with that, you have to find a vocational training, a VTE. Could you tell the audience about what GDC is basically, and along with that, what a vocational training is, and how difficult it is to get a vocational training, and how did you end up landing on a vocational training?
Yeah. So, I mean, GDC is basically just like PMDC, to put it
Yeah.
very in simple words. So it's like a professional body who keeps an up-to-date register of dental professionals. So
Yeah.
if you go on the GDC website right now
Yeah.
and you type the name of any registered dentist, they'll tell you the status of the registration, whether they're registered fully or with conditions or whatever.
Hmm.
So
Okay.
they also conduct the ORE exams, as you guys know.
Yeah.
And just with regards to getting registered with the GDC, it's not as bad, to be honest. Like I passed my exams in, I think, February 2018. Within
Okay.
a month and a half, I was registered with the GDC.
Okay.
About 3 to 4 months later, I got a job. And I think that it took 3 to 4 months because I was lazy. It was my laziness
Yeah.
of my part, because
Yeah.
I was preparing for MJDF part 2 at that time.
Okay. Okay.
So, it's eventually everybody who's registered with the GDC who passes their ORE exams
Yeah.
are going to eventually land up a VTE. I can guarantee that eventually. It might take more time and I'll tell you why it takes time, because like there is so much paperwork involved that getting those documents from back home takes too much time on our part.
Yeah.
Like you need the good standing certificate, academic
Absolutely. Yeah.
transcript, immunizations, letter of recommendations, things like that.
Yeah.
So that takes time. They just take about 3 to 4 months to process our application, not more than that. And just with regards to me landing a VTE, yes, the first step is more than anything. The first step is you have to have ORE or LDS to have
Yeah.
the registration and to get the VTE.
Yeah.
And like I had some, I don't think it matters, but I had some research experience in my bag. I had a publication, a case report as well, and I had some experience of working in the US. But none of this matters. I think the most thing that matters is they check, even when you get a job, they check whether you're the NHS and the local area team, they check whether you are eligible enough or you're at the standard to deserve that job. So they actually ask you in numbers, how many extractions have you done? How many fillings have you done? How many bridges have you done? How many crowns have you done? Have you got any experience in implants? Have you got experience in clinical photography? So, they ask you all of that. And even like assessing your application, they then accept that you are eligible enough or you deserve to have this job. So, yeah, I mean, I think eventually, like everybody who's registered will eventually get a job. So don't be put down by the people who are like, oh,
Yeah,
to
okay.
be honest, like when I
Yeah.
started, you know, they're like, there are no jobs in the UK. That was when I was going to appear for ORE Part 1. And that just put
Wow.
me down so much. I was like, okay, well, why am I even doing it if there are no jobs in the
Yeah.
UK, right?
Yeah.
So, I mean, don't be put down by everybody who's registered is eventually going to land a PLB. Yes, it's a little bit difficult to find PLB posts, but you will eventually get it. Yeah.
Okay. Perfect.
Yeah.
Perfect. So that's a very important answer, that you shouldn't be put down by people who are saying that there are no job opportunities in the UK. So
Yeah.
perfect.
Not
Okay.
at all.
So
Yeah.
so this is another question that many people ask. When
Yeah.
should a person when should a person take the MJDF or the MFDS exams, and do they help you in landing a vocational training in any way?
It's good to have it in your CV. Yes.
Yeah.
Because all the UK postgraduates, they do MJDF as the first degree after post graduation. So it's good to have something which is, renowned by the UK, to have it in your CV.
Yeah.
But to land a PLBE, I think it's just more your experience, your skills, the clinical skills, your past work experience, which matters. So,
Yeah.
they would really be looking at somebody who's at least
Yeah.
like got 1 year of experience of working
Yeah.
in their own country, and they've got some clinical experience in
Yeah.
working in primary care.
Yeah.
And they're not just somebody who's just come out of college and they're just going to start practicing on their patients. Know what I mean?
Yeah.
So it's the work experience that matters
Okay.
more than any
Perfect.
other degree. Yeah.
Perfect. Perfect. Okay. So now you've finally done your OREs. You're registered with the GTC. You do your training. Now it's time to work under the NHS. Now I want you to introduce dentistry under the NHS to our audience, because
Yeah.
NHS and private practice in the UK for our audience, because there are these misconceptions that if you pass the OREs and you land a job in the UK, you'll be rolling in money and you'll be earning a lot in the UK. While you and I both know that is not true when you're working under the NHS. It's a bit different. It's obviously more than what you'll get, but it is
Yeah.
different. NHS is a very complex organization, although a very good organization. But could you just introduce that system to the dentists, to international dentists who want to apply for the ORE?
Yeah. So basically, I mean, I'll just tell you the statistics a little bit.
Yeah.
That the dentists, the national average income of a UK qualified dentist is 123% higher than the national average income. So we are earning more than most other professions anyway. I'm talking
Yeah.
about NHS like I'm talking about dentists as an
Yeah. Yeah.
aggregate. So I mean, it's not bad at all. Like if I walk
Yeah.
you through the figures, so the good thing about NHS is very few practices are solely NHS. Most of
Yeah.
them are mixed. So
Okay.
your income is an aggregate of your NHS income, but
Yeah.
there is very limited procedures. There are limited procedures that you can offer on the NHS. So
Absolutely.
for example, like bridges are not covered, implants are not covered, white fillings are usually not covered, veneers are not covered under the NHS. All of this
Yeah.
is private. So
Yeah.
now that I work in a mixed practice, I can always make that extra income by offering my patients that private, the private options
Yeah.
as well.
Yeah.
So your income in this way becomes an aggregate of your NHS income, your private income, both of these,
Yeah.
except for a private practice, which is, yes, they're charging £600 to £800 for a root canal treatment, quite good.
Yeah.
But then, they wouldn't hire somebody who's at least they should be a specialist, or they should have an MPhil or a master's or something, or you
Absolutely.
should have the specialist training to be working in a private practice.
Yeah.
And the litigation is really high. Like if you make a
Yeah.
mistake, for example, like you've made a 22 grand implant for somebody
Yeah.
privately, if it fails, I would be in absolute shambles, and
Yeah.
I would be really worried, because the litigation increases when you're working in an all private practice. And of course, you should be doing your marketing. You should be really, really established to be earning so much in private practice. So I quite like the mixed setup. And most people, a dentist, ask me in the group, how much is the monthly income? I mean, what should we be expecting? So I'll tell you a little bit that less than 5 years of qualification, like after training and everything, I'm talking about after training, you can expect earning anything between, I'm talking on the lower end, 60 to 80,000 pounds per year. Right. So that makes about 4,100 pounds net income, which is quite decent. Very, very
really
decent.
good.
Live very comfortable
decent,
lifestyle. And if you're a practice owner, you're working in a private setup, anything like that, you're earning anything between, 90 to, it can go up to 150,000 per year, more than that as well. But I mean, I quite like the mixed setup. I think when I feel that I'm confident enough to work in an all-private practice, I might just shift to one. But at the moment, I'm comfortable with this one.
Perfect. Okay. So my next question to you is, what are the future prospects for international dentists in the UK post-Brexit? Because now that UK is not a part of the European Union, does that affect dentistry in any way? And what are the general prospects for international dentists in the UK?
So, I mean, to be honest, I think Brexit has worked in our favor, because most of your European dentists are going back to the Europe. So they've got a couple of slots for like dentists which are open now, and they're constantly hiring. I know that for a fact, and the future prospects are amazing. I think once you're in the system, the prospects are immense. There are courses that are running on all the time about veneers, crowns, bridges, smile design, Botox fillers, there's so many things which are which they're running courses wise. So you can always develop yourself clinically with taking those courses, right? I mean, I've taken so many courses, and I think if I hadn't taken those, I wouldn't be practicing at the moment, because as a fresh graduate, I wasn't, I mean, clinically, it was very little that I knew.
Absolutely.
And second thing is the prospects. The Royal College of Surgeons has started postgraduate diplomas, like the one that I'm doing in restorative dentistry, aesthetic dentistry, implant dentistry, which lead to masters. So it's a cheaper way of doing masters rather than going into King's and paying them like £100,000 to get a master's degree or an MClindent. So, and there's always MClindent, there's masters. Then you can get into postgraduate specialist training as well, which is a 3 to 4 year program. But you should have like at least 1 year of training and working experience in NHS to get into that. So prospects are immense once you're in the system.
Okay, that's absolutely perfect. Okay, so you've already told us that aesthetic and cosmetic dentistry and restorative dentistry is your niche, and that's what you're looking forward to doing. So, but why this specialty now? Considering that you were initially more interested in maxillofacial surgery, why are you more interested in cosmetic dentistry now?
Well, I still enjoy extractions and maxillofacial surgery. But I mean, but as soon as I think when I started preparing for ORE and when I started working in clinical practice, I was more drawn to aesthetic and restorative, because first of all, there's a huge demand for aesthetic, like cosmetic procedures at the moment. Like, so more and more people are they're wanting to have fillers, Botox, like the perfect smile with veneers and everything. So I quite enjoy doing that. And secondly, I think to be able to do something which has got great emotional value for the patient is quite amazing. So no matter how small it is, like something as small as midline blastema can be corrected with dentine bonding or veneers, or something as small as that. So, but it can make a huge difference in the patient's life. So I think, say, people are very, very emotionally connected to their own, self-consciousness or, insecurities or whatever, and we're able to make a difference in that. which is absolutely amazing when you see that smile that, you know, they're like, oh, I love it, you know. So
Yeah.
that just makes my day. Yeah.
Yeah, that's absolutely brilliant. Okay, so moving back on topic, some dentists from Pakistan go for their masters, they go for MCLIN dents programs as well. Some go for masters in oral biology, pathology, masters in public health to the UK. What is the scope of these masters, of clinical masters and of, for example, public health or oral, these basic sciences masters? What is the scope of these masters if you want to settle in the UK?
Yeah. So I mean, I don't know why. I mean, I don't know why people do that, because like to have a master's, you have to pay them at least like 25 grand every year,
Yeah,
for most universities. So you're paying 3 to 4 times if you're going to King's, even higher. It depends on universities, to do these masters, right? And they wouldn't let you practice dentistry in the UK without having an ORE or LDS, without being
yeah,
registered. You cannot practice. You can
absolutely.
maybe, you can maybe like teach, probably, if that's what you aim for. But I think that the turnover for doing masters, even if you go back, you know, most people are like, oh, I've spent about 40, 60 grand doing this masters, and now I'm going to go back to Pakistan. So how much they're getting paid after they go back to Pakistan after doing a master's in oral surgery
Yeah,
and oral path? It's like,
absolutely.
you know, it's like 1/6 of my income,
Yeah,
you know, like
yeah,
monthly income, I'm saying. So it's like
yeah,
500 pounds every month, which I don't think is the best turnover. Yes, you can do masters after you're registered, absolutely brilliant. But I think the first criteria should be, if you want to practice in the UK,
yeah.
get your OREs and LDS done, or LDS done. Yeah.
Perfect, perfect. That's what so many people, are confused
They
about.
do
And
that.
that's a,
They
yep,
do that. Yeah.
absolutely. Many
Yeah.
people do that.
And they're so
Yeah,
fixated. They're like, why are you
yeah,
not supporting our cause? And I'm like, why are you spending so much money doing this? You know, just
yeah.
do ORE. It
That's
will
exa
cost you much less than that. Yeah.
That's exactly what I used to think. All right,
Yeah.
perfect.
Yeah.
So, moving on. Now, you just mentioned LDS, and I hadn't mentioned this question, but it's a very good question. Many people don't know about LDS. The even I can't remember the abbreviation of LDS, but what's the difference between ORE and LDS, and why is there another licensing exam in the UK as well, known as
It's
the
absolutely
LDS?
the same. I mean,
Yep,
the outcome is absolutely the same. You can do ORE,
absolutely.
LDS, you know, it's up to you. The only thing is LDS, you can write with your name as a
Hmm.
degree,
Okay.
which is a
Well,
plus, yeah.
yeah.
But the only thing that bothers me about LDS is that there's very little guidance. There are
Hmm.
a few courses out there for LDS as compared to ORE. So
Hmm.
like the outcome is the same. You get the registration, but LDS you can write with your name as a degree. And it's they say that the time that they allow you for OSCEs is, in OREs, patient communications 5 minutes, you know, for LDS, it's a little bit like four minutes, 30 seconds.
Yeah.
So it's
Okay.
just a little bit on the tougher side, but it's kind of like the same.
Okay. Perfect.
Yeah.
So,
Yeah.
okay. So, moving on, if someone like me, like many of my colleagues who are young dentists, fresh out of the box, doing their house job or in final year of BDS, or just graduating soon, and aspire to go for their OREs, what would your advice be to a young dentist who wants to go for ORE post COVID-19? What would your advice be to them? What should their mindset be?
So let me just clarify something about COVID-19. I mean, things are pretty much coming back to normal. You
Absolutely,
know,
yeah.
they're just becoming the robust infection control measures in place. You know, things
Absolutely.
are more safer. You have got more PPE as compared to before, but they're still hiring. They're still working. We're still seeing patients all the time. So, I mean, you know, don't be put down by the fact that dentistry has completely changed and they won't hire you after COVID-19. That's not true.
Yeah.
Um, and just with regards to like a fresh graduate wanting to go for OREs in UK, I would say just absolutely go for it. Like, it's the best
Yeah.
investment that you can ever make for yourself. It's an amazing, like, it's a very, very relaxed lifestyle. You can choose to work 3 days, 4 days. It's a very decent income. um, there's always ways to develop yourself. There's always, new things coming up. You're learning new things, new technology,
Absolutely.
really cool stuff in dentistry, which
Yeah.
I absolutely love. And you guys would I think would love that too, because at least you're
Yeah.
getting a turnover, or
Yeah.
a return
That's
for
important.
whatever you're
Yeah.
doing. And you're feeling that you've done something, rather than feeling miserable all the time for
Yeah.
not being paid enough, or not having like purpose of why you're even a dentist, which most
Yeah.
people feel, I think, after
Absolutely.
graduation.
Absolutely.
Yeah.
Yeah. Many people do that. I'm in that state right now, but hopefully everything will work for the best. But yeah. Okay. So my
Yeah.
next question to you, you've seen dentistry being practiced in the UK. I did an elective at King's College a year back in my final
Oh,
year
wow.
of BDS. I saw dentistry being practiced in the UK just two weeks in at King's College, and there was some major differences that I saw in dentistry being practiced in Pakistan and dentistry being practiced in the UK.
Mm-hmm.
So,
Mm-hmm.
if you had to pinpoint some differences that you saw being practiced in Pakistan and in UK, what would
Yeah.
they be?
Well, first of all, everybody's very work oriented. When they're working, they're only just working. Nobody's just roaming around the cafes or having teas or whatever at work time. Work is work, right? So you really invest that time in your patients. You really make your time of your work and job worth it. Um, and secondly, and they have an incentive for that, because I think the more people that you see, the more patients that you see in the NHS, the more you're getting paid, right?
Absolutely.
So they give you an incentive to work. And secondly, I think the major difference is that continuous professional development, I think,
Yeah,
which is that
absolutely.
dentistry is completely evolving, changing all the time. And
Absolutely.
we are not I think we're not keeping ourselves up to date with the
Yeah.
changing information, the changing new technologies that are being introduced. So
Yeah.
there's such cool stuff, like the
Yeah.
iTero scanners, the digital CAD cam planning, 3D implants, everything.
Absolutely. Absolutely.
It's this absolutely
Things
amazing stuff that we should
things are getting
be
really, really
knowing.
exciting in dentistry. Things are getting really, really
Yeah.
exciting in dentistry. Yeah.
Yeah. And
Absolutely.
secondly, like you should there are new guidelines all the time. They're
Yeah.
like I still know people who would prescribe antibiotics after extractions, which is I mean,
Yeah.
because they're just old school and they're not willing to change. Who would still
So many people do
stop
that.
aspirin, who would still stop aspirin before extractions. And I'm like, that's changed 40 years from today. That's changed.
Yeah.
Just keep yourself up to date. So I think those are the major differences, and we really need to keep ourselves up to date with the new knowledge. And secondly, really, when we are at work, just invest your time in clinics, invest your time in learning those new skills, because they're really going to help you later on.
Yeah. So coming back to your point about things that were in the past, you recently posted about prophylactic removal of wisdom teeth, and I had just gotten my wisdom tooth removed due to pericoronitis. So, evidence-based
Yeah,
dentistry is something that we should be looking forward to doing. All right.
definitely.
So
Yeah.
moving towards the end of our interview, you have a group. You started a group by the name of ORE, where you help international dentists, where you post amazing stuff, where you post
Yeah.
evidence-based stuff. So that's amazing. Would you like to tell a little about that to our audience, so
Oh
that they
yeah.
could join
Well,
the group and get help from that
definitely.
group, because it's amazing.
Yeah,
Yeah.
definitely. So I honestly set up this group because when I started my ORE, first of all, to motivate others, because when I started my ORE journey, everybody was like, oh, first of all, there are no jobs in the UK. Secondly, there is no seat for the UK exam. Thirdly, you're never going to end up a job, and you're never going to be able to pass ORE too. So I just want to like tell people that you guys can do it as well. And I want to see more and more people from my country, like like I see from other countries, to be succeeding, to be, I'm not saying all of you come to the UK, but like succeed in your profession as
Yeah.
professionals, become good academics and professionals. That's my first goal. And secondly, keeping themselves up to new guidelines, up to date with the new
Yeah.
guidelines, clinical information. That's the second. And the third one was the motivation behind setting up the group was really to help, because
Yeah.
most people who've done these exams, I don't know, they just hide information like it's the Da Vinci Code
Yeah.
or something. Like, it's just, I mean, just try to help each other, raise each other up, and don't put yourself down, and don't act like I'm the only alien genius who can do ORE. You guys can do it as well. You guys have it in you. So yeah, that's the purpose of
Perfect.
this group. And you guys can find me and find all kind of information that you require on that group, and you can
Yeah.
personally text me as well if you require something.
Perfect. So I'm a part of that group as well, and I know that anything you want to be answered about ORE, vocational training, MJDF, MFDS, anything you want to be, it's the answer is on there. So kudos to you, amazing group.
Oh, thank you.
So yeah, so moving on to the last question of this interview, what do you think about this very small startup of ours, and any advice that you would like to give us?
Well, I think that you are doing an absolutely amazing job. It's
Thank you.
because it's just amazing to find bringing all the alumni together, because it motivates the fresh graduates. It gives them a
Absolutely.
reason and a purpose to look forward to. It tells them what their field actually involves, and
Absolutely.
how vast it is, and what are the ways of succeeding, and it's so much out there to explore. So I mean,
Perfect.
kudos to you as well to bring all of these people
Thank you.
together with different experiences who can guide others. And because that's I think we were really that's where we really lack of
Yeah.
guidance, and
Perfect.
not knowing where we need to go or end up really after we
Brilliant.
graduate.
Brilliant. Brilliant. Thank you so much, Dr. Sarah, for sparing time
Yeah.
out for us for this interview. I know you have a very busy schedule, and we hope to see you back here soon with us. It was
Yeah.
really an honor. I got to learn a lot from you, and but thank you so
No,
much.
it was an
It
absolute
really meant.
pleasure as well.
Yeah. Thank you
Thank you
so
for
much. I
having me.
hope you take care and stay safe.
Yeah.